Can PRP injections for face, the Vampire Facelift, be safely done to patients who have hepatitis C with no unexpected side effects?
Thank you for your question. You're asking if the Vampire Facelift can be performed on someone who happens to have hepatitis C, and concern, of course, about potential side effects. Well, I can certainly give you my perspective based on this simple, very straightforward question about hepatitis C and the use of platelet-rich plasma. Just a little bit of background. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I'm a very active member of the Vampire Facelift network of physicians, and I've been a resource to the media when occasionally when questions about the Vampire Facelift arises, often when a celebrity has a procedure related. So I can give you basically the evaluation process when someone comes to us, a little bit about the evaluation process when someone comes to us and gives us a history similar to what you're describing. So to begin with, let's understand a little bit of the basics of the science around the use of platelet-rich plasma and determine if this is the right thing for you. To begin with, platelets and the concentration of the plasma, which is the vampire part of the procedure, is intended to stimulate the building of collagen, blood supply, and the improvement of tissue quality. And what that basically results in when we use it in this type of procedure is a beautiful, healthy glow to the skin. It is also an improvement of fine lines and improvement of generalized skin texture and quality. This is based on a science of the effect of platelets. And what do platelets do? Platelets are the cells in the body that are activated when you get a cut. So the question that I would ask first to a patient for any medical condition is, what happens if you get a cut? Does it take you longer to heal? Do you have any problems with healing? If you were to cut yourself shaving, or if you were to cut yourself in anything, do you have any issues with healing? If you don't, then chances are it's not going to be an issue. Hepatitis C is a chronic viral infection of the liver. That means that if it's very active, well, then chances are you're not going to want to do anything because you need to manage your liver inflammation. But if your liver function test and other blood work is good, then there should be no issue with having a treatment like this. You're drawing your blood, you're separating out the platelets, and you're having the injections performed in a way that should be no different than it would be for anyone else. It's actually something that it's important for the people who perform the procedure to do what is still standard regardless, is this method of precautions to avoid inadvertent contamination or injection of your blood into a staff member. But from your perspective, if your goal is to achieve improvement in skin quality, then there should be no objection. If there's a question in your mind about the state of your liver function and your general state of health, go to your medical doctor, have a full blood workup done, and bring this to the doctor that you are considering choosing to do the procedure for you. But from as I said, from my perspective, this, amongst many other different chronic medical conditions, have not prevented people from having PRP treatment. It's remarkable. As long as you can have good platelets and they function well, there should be no issue. So I hope that was helpful. I wish you the best of luck. Thank you for your question.